Hi, Mr. K. Welcome to our session today. And thanks for being here. As you know, my name is Dr. Noelle, and I want to keep my promise from our last session when we talked about or addressed your question uh, where you asked if ibuprofen was the best medication for your headaches. And uh, the summary of that of the answer to that was that ibuprofen wasn't the best because of the many negative side effects it has, and also because ibuprofen is an anti-inflammatory medication, and the common headaches are usually not caused by inflammation. And we recommended Tylenol as a better option. But I don't want to go into details. If you want to remember, you can always go back and you know watch that video again. Today, I want to keep that promise of giving you some relevant information about headaches. Just the basic stuff about headache. So the word headache basically, means pain in the head, um, because ache is another name for pain, and then head is head. Yeah, so in order to talk a little bit more about headache, let's talk about some basic classification that in the scientific world, for physicians, we normally classify headache into two main categories. The first one is what we refer to as primary headaches, and the second one is secondary headaches. So primary headache means is just headache. We are not the cause of the headache is not very clear. While secondary headaches is a headache that comes on as a result of something that is known. So for example, secondary headache means a headache that comes on because someone has had a stroke. Like someone bled, has bleeding in the brain, that will cause a headache. Or if someone has an infection, you know, in the brain, that will also cause a headache. So that's what we mean by secondary headache. Um, so for the primary headache, they are usually classified based on the nature of the headache, some basic characteristics of the headache. So there are usually three main categories for primary headache. So one is tension headaches, another one is the migraines, and then another one is referred to as cluster headaches. So a lot of people know about migraines, because people talk about it a lot. So, and then tension headache is usually the headache that people get from time to time that is quite common. So, tension headaches and migraine headaches are more common. Cluster headache is a little bit of a rare variety of the primary headaches. So tension headaches usually comes on like someone feels maybe like someone is squeezing, like there's some pressure pressing us, maybe in the forehead or in the middle of the head somewhere. And then it comes and lasts a short while, then it goes away. Sometimes we take medication for it, sometimes we don't, and it still goes away. The migraine headaches usually common as throbbing headache, and quite severe, and they're also usually accompanied by other symptoms. So usually tension headache is just a headache and nothing else is happening to us. But migraine headache, usually people will have some nausea. Uh, it could be as severe as also the nausea, causing vomiting. And then also people will like have an aversion to light. They want to be in a dark place, and noise also aggravates the headache, so they prefer silence. So that's really the migraine type of headache. The cluster headaches, which I said before, are very rare. Usually also one-sided. They're usually very intense, and they tend to come at the same time every day and last, some minutes or hours, and then they'll go away, and then repeats itself. Like it has a pattern, and maybe it will feel like a sharp pain around one eye. Um, so, but yeah, so those are the three types of primary headaches. And so let's talk a bit more about the tension headaches. So usually the tension headaches could be due to stress, lack of sleep, or we don't have enough water in our body, so that's dehydration, or we skip meals, or we spend too much time looking at the screen, so that can cause a headache. Um, so there are certain things we can do to help ourselves when we have this kind of headaches, So I mean, when we have headache, usually it's not the best thing to just go for pills, even if they are over-the-counter pills. So it's better to see what could be causing this headache. So it causes us to reflect. Did I skip a meal? Have I been drinking water? Did I have too much coffee? Because those are things that can cause a headache. A lot of people know that also when they've had too much alcohol to drink, they get a headache. So that could also be the cause of the headache. So it's a question of limiting the things we know that trigger the headache. And a lot of times also people don't realize, I mean, the caffeine uh, can be found in coffee, but there's also caffeine in tea, there's caffeine in the energy drinks. A lot of drinks now have a lot of caffeine, these drinks that um, boast about, advertise themselves as giving you a lot of energy during the day. Usually the energy is coming from caffeine because caffeine is a stimulant. And so people tend to drink a lot of coffee during the day, and when they are doing that, they're not drinking water, and then the caffeine itself stimulates you to use the bathroom more, and that means you're losing more water. You're not replacing the water you're losing, so that causes dehydration. So usually when we get a headache, it's better to just try to rehydrate ourselves. That can actually even just resolve the headache. And then we also need to be observant. Some people are sensitive to certain foods, so certain foods can trigger a headache. And so it's good to be aware of that. The other thing to know is that migraines also have a genetic factor. A lot of people who have migraines have people in their family who also are suffering from something similar. So genetics play a role in that. And then our lifestyle, like I said, can also. So if we address those issues that we can take care of and the headache is still bothering us, we can try the Tylenol. But before we uh, do that, before we settle on the over the counter treatment, it's good to reflect and see whether there are some red flags to the headache. So like I said, I was concerned um, about you having this information. That's why I'm doing this today, to know what are the red flags, what are the indications for me to go to the ER if I have a headache, or even if I don't go to the ER, call my doctor's office to see if I need to go to the ER. So red flags are like if you're over 50, and all of a sudden you're getting a headache you've never had before in your life. Maybe you've never had headache, and now you're 50 or more, 50 years old or more, and you have a headache. That headache requires medical attention. If that headache feels like a thunder just went off in your head, um, or you feel like this is the worst headache of my life, very intense, all of a sudden, very severe, you need to call 911 or have someone take you to the ER right away. Um, and then also, if the headache is accompanied by stiffness in your neck, or sudden vision changes, or you find yourself confused, your speech is slurred, um, yeah, that headache requires immediate attention. Okay, preferably in the ER. So have someone take you there or call 911. Um, Another indication that a headache requires immediate medical attention. If the headache comes on as a result of injury or you fell, you need to be checked out right away. Also, if it's a headache that is waking you or comes on at nights and actually wakes you up from your sleep, that headache also needs medical attention. It's not enough to just take Tylenol for it. Um, and like we said, it's also better not to even take the ibuprofen, because ibuprofen can actually cause a bleed. So if your headache is being caused by a bleed, taking ibuprofen for a headache will actually make matters worse. So in summary, most headaches are not dangerous. They can be annoying, um, but they're usually not dangerous. So I mentioned these red flags because those are the dangerous headaches that require immediate evaluation. So if your headache um, falls into any of the descriptions I just mentioned as red flags, then you know what to do. Call 911 or have someone take you to the ER. Um, and then yeah, and then also don't rely too much on medication if the headache doesn't fit any of the doesn't have any of the red flags I mentioned, and then you take Tylenol for the headache and the headache doesn't go away, uh, remains constant or keeps coming back after you've done everything to resolve it, all the tips I gave you, um, and it's still not going away. It's lasting like 2, 3 days, and you keep taking Tylenol like 3 times a day. Uh, don't go past 3 days. Even 2 days of such a headache, you need to call your doctor's office and have yourself checked out. Because another thing that can actually cause a headache are the medications themselves. When you overuse those medications, they cause what is called a rebound headache. So taking too many pain pills um, for a protracted period of time can cause headache. Uh, so in summary, yeah, I think we've summarized it enough. And if I don't want you, to feel like you need to be macho about this. If your headache is interfering with your activities, seek our help. That's why doctors are there. And then, yeah, thank you for listening and watching this video. If you have any more questions, shoot me an email or paste it in the comments, write in the comments. And also, I want to remind you that in the near future, I'm going to have an office where I'll be taking care of patients who become members of my clinic. The clinic is called True Smart Care. It doesn't have a physical space yet, but keep coming back to this channel and you'll be informed when the clinic is about to happen. It's gonna be a membership kind of system. No insurance based. It's not gonna be insurance based. It's gonna be very affordable. So yeah, stay tuned and thanks again. All right, Mr. K. Take good care of yourself. Bye bye.